recently in an incident that made headlines as a JMPD officer was allegedly turned away from a local private hospital because he did not have medical aid. Also, the City of Johannesburg reportedly owes Milpark Hospital 35 million rand. But with the NHI in the back of our minds, let's ask just what obligation does a private hospital have to stabilize and treat patients who can't pay? We speak to Dr. Mvuyisi Mzukwa, who's the chairperson of the South African Medical Association. Dr. Mzukwa, very good evening to you. I'm sure you saw that story that made headlines of that JMPD officer who was allegedly turned away. Look, I mean, the hospital says they did actually stabilize the officer, so I don't want to get into the nitty-gritty of that case in particular, but just at large, what it actually means, what the protocols say when you arrive at a private hospital and you don't have medical aid. Are they obligated to treat you medically?
Good evening to you, Masa, and your viewers and your crew. Thanks for inviting me. I'm glad we're not talking about talking to the merits of this case, but we're talking in general what is expected, of us. There are two pieces of legislation that governs how you attend to an emergency. The Constitution and the National Health Act. It provides that nobody shall be refused emergency medical treatment. Now, if you look at the National Health Act, it does not really have a definition of the emergency medical treatment, but the Constitutional Court defined it as a dramatic, sudden situation or event which is of passing nature in terms of time that needs immediate medical attention, without which the person could die or lead to a serious harm. So I think that's where it is. But if you look at those two, it says nobody shall refuse emergency medical treatment. So it does not matter whether it is a general practice, like a general practitioner. If something happens next to you, can go into that general practitioner and get help. It does not matter if it is a private clinic or a private hospital or even a central hospital, like those big hospitals like the Nelson Mandela Academic Hospital in Umtata or the Inkosi Albert Tuli Hospital in KwaZulu-Natal. Hospitals like those, you can just go in there if you've got an emergency condition. Now, you cannot be refused by the security guards or even by the administrative staff, because they are not trained, to assess whether it's an emergency or not. It has to be a medical personnel that attends to that person and says, this is an emergency, and if it needs a resuscitation, the person must be resuscitated. But if the person is not on medical aid, it means the institution will not be able to admit or whatever the case is. But the institution must stabilize this person. If this person is bleeding, they must stop the bleeding. If this person he can't breathe, they must make the person breathe, in terms of incubating that person. And then you don't just then drop that person in an ambulance and send over to a public institution. You call the public institution at which you are referring to. You talk to a particular doctor. You must register the name of the doctor that was spoken to, and then you must arrange an ambulance that takes this patient right there. And that's the process, and have a referral letter stating what you have done, the treatment that has been given. That's the process that is required in all the cases of emergencies, if the person is not on medical.
So basically, they cannot be sent away. So I just want to get it in terms of like practical, on-the-ground experience. So you said it has to be an emergency, of course. So if the person, let's say, has a gunshot wound and was shot, you're saying the hospital has to stabilize them. If they're bleeding, they have to make sure that they stop bleeding. If that means that it requires further medical attention, perhaps surgery or anything else outside of the ER, for that person to be made to stop bleeding, does that medical facility, that private facility, then have that obligation, because the only way to stop that bleeding is to then give them further medical care, even if they don't have medical aid?
You can't transfer a patient that is not stable, ma'am. That's the underlying factor. If it means something is done in theater, that patient must be taken to theater. The issue here is to stabilize the patient. The patient must have, should I say, good vital signs like your BP, blood pressure, your pulse, your breathing normal, good oxygenation. On top of that, this patient, as I said, must be referred to another institution, for further investigation. But if the patient is unstable, a patient cannot be referred, because that patient may lose, their life along the way. So you can't refer an unstable patient. It has to be stabilized.
Okay. So what happens, Dr. Mzukwa, in the case where you have a patient who has either been in a car accident or has a gunshot wound or a stab wound, and there is a public healthcare facility, but they opt to go, and we know that there are challenges there. There's also always long queues, snaking queues, and whoever is transporting that patient opts rather to take them to a private hospital, knowing that they may get that help a little bit sooner so that they're stabilized. Is that something that is appropriate as well, that you know you don't have medical aid, there is a public facility nearby, but then you opt for the private one, knowing that they cannot refuse you medical attention to make you stable first?
The issue is that you have to be taken to the nearest institution. I think if there's a nearest institution, there are protocols in those institutions where, they do what we call triage, where you categorize patients according to their severity. So even if it's a hospital with a long queue, there are those instances where you do a triage, and then that patient will not be following the queue because it's an emergency. Emergencies don't at all follow the queue. So it would be unfortunate if the person leaves the nearest institution to rush to another institution, because what you are doing, that you are putting the life of the patient at risk. It could be problematic, especially if those are ambulances. These emergency transportations, they could be taken to task if they live at the nearest institution, because you need immediate help for that person. It's not a good idea to take them to a far institution because you are running away from a queue, because that is manageable. They know how to act when there's an emergency.
Okay, and just finally, Dr. Mzukwa, when it comes to this as well, in light of NHI as well, how can then private hospitals also mitigate, against their bills running into the high numbers? Because there obviously will be a cost at admitting people, or not necessarily admitting them, but stabilizing people that aren't going to be able to pay for those services.
I think, ma'am, I need to remind you that as the South African Medical Association, we have taken the NHI to court so that it is clarified. It's a very unclear entity that I really can't talk around the NHI, because I don't know what it is in terms of how it's going to be dealing with the issues. But what is of concern to me now, ma'am, is the fact that professionals are regulated. They've got their regulatory bodies. But the problem is that private hospitals don't have a regulatory body where they can be, taken to task. If there's a misconduct against me, I'll be taken to the HPCSA. If there's a conduct against nurses, that taken to the South African Nursing Council, and so on and so forth. But when it comes to hospitals, there is no established regulatory body that is going to be taking this to task. Because if you look at the Office of Health Standard Compliance, it's not really a regulatory body for hospitals. It's an entity that deals with different issues altogether. So South Africa needs to have an institution or a regulatory institution that deals specifically with hospitals, especially private hospitals.
Yeah. That's true indeed. Thank you so much for your time and just helping us make a sense of this all and how it operates as well.